here we are, all three of us, to listen to Mr. McGee's speech.
Ball your hand into a fist. This is the size of a normal kidney. Now let's take a look at this football. This is the size of a polycystic kidney. This can be found in the age of a 10-year-old. The purpose of my speech is to inform you of what polycystic kidney disease is, how it is treated, and who it affects. My name is Misty McGee, and this is for CST 100. I'm a registered respiratory therapist. I've done extensive research on this subject because my son, who is 8 years old, has ARPKD, which is a form of PKD. I've spoken with many urologists and many doctors as well. So what is PKD? PKD is a disease that causes cyst-like bumps to develop on a patient's kidney. These patients usually end up with kidney failure and dialysis and eventually kidney transplants. If you look at these patients, you can see a slight bulge on their sides from how big and rapid their kidneys have grown. According to PKD.org, a normal kidney weighs 1 pound, but a polycystic kidney can weigh up to 30 pounds, and that can be found in a 10-year-old. So who gets PKD? How do you get PKD? There are two types of PKD, ARPKD and ADPKD, one meaning dominant, one meaning recessive. ADPKD is the most common form, and it's also the fourth leading cause of death according to PKD.cure.org. More than 50% of patients diagnosed with ADPKD will develop kidney failure by the age of 50. Dominant PKD affects whole families and does not skip generations. This information was found on the Mayo Clinic's website, article Polycystic Kidney Disease. ARPKD is a recessive form of PKD, and it only occurs in 1 in 20,000 children. Most children diagnosed with ARPKD die by the age of 1 month. Those that live, according to PKD.org, 1/3 of them will end up with a kidney transplant by the age of 10. When they have children of their own, they have a 50% chance of carrying this on to their children. ARPKD is a recessive form, so it can skip generations and can be unexplainable to its cause. This is the face of ARPKD. Jackson McGee was diagnosed with ARPKD at the age of a newborn. He had 2 kidneys when he was born, but one failed due to the rapid growth of cysts. The other one functions at 70% and at its most has only had 5 cysts. Jackson is energetic and fun and loving, and you would never know he had this disease unless you asked him or read his medical ID bracelet. So what happens to your body during PKD? How do we treat this disease? Unfortunately, there's no treatment. There's no way to get the cyst off the kidney unless you go through a kidney transplant. Patients with PKD usually end up with high blood pressure, lots of pain, kidney stones, urinary tract infections, and can even have aneurysms. Most people take the blood pressure medications and are prescribed narcotics due to the massive pain that they're in. It's very important for PKD patients to use the restroom as soon as they need to, because this prevents them from getting UTIs and serious kidney infections that can ultimately affect their kidney function. Most patients do not get the urge, however, to use the restroom, and they end up being cathed. These are just a few of the physical effects that PKD has on a person. To summarize, I hope you learned what PKD is, who it affects, and how it is treated. PKD is a common disease that most have not heard of. This disease is very, very real and harms anyone from a newborn to 99. It does not discriminate. My hope is that this speech has shed some light on the process and you have a better understanding of just what PKD is. Does anyone have any questions? Yes.
How many cysts can I get on your kidney?
You can, multiple. You can get hundreds of cysts on your kidneys.
Are they big or small?
They can be tiny and then they can be massive. The biggest one I've seen was probably the size of a fist.